A stark warning from the World Health Organization.
This high transmission is deeply worrying.
The UN blames a surge in seasonal travel for a rapid rise in coronavirus cases, even with millions around the world at the mercy of government travel restrictions that some criticize as confusing, inconsistent, and unfair. I'm Andrea Sankey, and today's Newsmaker is COVID-19 travel restrictions. Now, the pandemic forced the world to tighten its borders, hitting travel and tourism hard. Now, while several nations remain more or less isolated, others have opened up. Some warn, however, that it's too soon to resume free movement. On Monday, the World Health Organization said a seasonal surge in travel was partly to blame for the rise in infections. Travel and tourism, of course, aren't as straightforward as they used to be. In most cases, you have to navigate through tests, documents, and quarantines just for a simple trip abroad. Some argue the regulations don't really help prevent the spread of COVID-19, and many feel the way restrictions are implemented is simply unfair. Take the UK, for example, which has adopted a traffic light system. India, which has the second highest number of cases in the world, is on the UK's Amber List, which makes entering the UK relatively easy. But Turkey, which has far fewer infections than India, is on the Red List, making travel to the UK almost impossible. Travelers coming from red-listed countries have to quarantine in government-approved hotels, which cost them thousands of dollars. But if you're returning from a country on the Amber List like India, you only have to self-isolate if you haven't been fully vaccinated with an approved shot. Now, we've also been repeatedly told the best way out of the pandemic is through vaccinations. But according to the WHO, the rate at which people are getting those vital shots is falling.
In the past 6 weeks, vaccination uptake has slowed down, influenced by a lack of access to vaccines in some countries and a lack of vaccine acceptance in others. Vaccine skepticism and science denial is holding us back from stabilizing this crisis. It serves no purpose and is good for no one.
So with fewer people being vaccinated and infection rates rising, is it time to reimpose stricter travel restrictions? Or do we need to rethink the whole system? Well, to discuss that and more, I'm joined now from Torquay, England by Simon Calder. He's a journalist and travel editor at The Independent. Ben McCluskey is in London. He's a COVID data analyst specializing in travel. And in Geneva is Oksana Pyzik, a senior teaching fellow at University College London School of Pharmacy and an expert on COVID-19. Simon, let me start with you. First, let's just establish whether you think travel restrictions actually keep us safer, and are they worth whatever damage they may be doing to travel and tourism?
That's a great question, and the damage that they are doing to the travel industry, particularly in places like the UK, is immense. I'm surrounded here on a beautiful resort on the south of England by British tourists. There are no foreign tourists at all because the UK has decided that it is going to make the UK very difficult to get into with multiple tests, which will cost upwards of $150, and of course very, very complicated with 5 different layers of restrictions depending on the country you are coming in from, ranging from almost none for the Republic of Ireland to, well, yes, Turkey on the red list, requiring 11 nights of hotel quarantine at a cost of upwards of $3,000 for the traveller. That is keeping people away from here. It's keeping people off the aircraft. And of course, it is meaning that an awful lot of the economy of many parts of the world is very badly affected. The extent to which these work, well, I guess you have to look no further than Australia, which has perhaps the most extreme policy of all in terms of its own travellers, which is saying if you're Australian, you cannot go abroad without special permission. They've got a very strict policy for coming into the UK, but overnight we saw, as I think Ben may be able to confirm, record numbers of cases in the biggest state, most populous state of New South Wales.
Right. I think that's a really interesting case to make, actually. It's the one more purest example we have of total isolation being, Australia and New Zealand are now hitting lockdowns again. But Ben, do you think that is a good case? Do you think it really isn't keeping us much safer than if borders were left open for summer tourism season?
Well, I think many will make the case that we need to accept an element of risk. Last year, travel, at least here in the UK, was far less restricted. We didn't have vaccines back then. We didn't have free testing, things like that, testing schemes in place. A year on, we have a lot of our population vaccinated.
But we didn't have the Delta variant either.
We didn't have the Delta variant, that's true, but we do have a good level of protection amongst our population and in a lot of European countries as well. So I think, again, we do have to accept an element of risk here, especially in protecting our economy. I think that is the key thing here. There has to be a balance between restrictions and also allowing the freedom of movement once again. It's not just, again, holidays that it's dependent on. It's also about seeing families and restarting business travel. And that is a key question when it comes to transatlantic movement.
Right. I want to actually get back to that. But I mean, as we're looking behind Simon, we can see in the background there that, okay, there might not be international tourists, but all the tables behind you, Simon, are quite full. And I've noticed here in Turkey as well that even though a lot of international tourists, I mean, particularly from the UK, haven't been coming to Turkey, the hotels are doing relatively well because a lot of Turkish travelers are choosing to stay in the country rather than deal with the complications of trying to go abroad. So, I mean, Simon, is there a balance there then that kind of comes into play with maybe there are international travel restrictions, but that boosts the domestic market?
No, unfortunately, I think the only place where that really can be said to work is in the United States, where one reason that they have a blockade on people coming in from the UK, from Europe, from Brazil, from South Africa, is because their tourism industry can withstand it. If you are in Alaska, you might well want to go to Florida. If you're in New York, try California. That doesn't work here. In terms of the UK, for example, where yes, and I've met many people just today saying, yeah, we'd normally be in Italy or Spain or France, but we're staying in the UK. The latest figures I have is that the UK will have about $80 billion in terms of UK tourism this year, compared with what would normally be about 120 million dollars in UK tourism. So it doesn't work. We're also losing well over $40 billion in incoming tourism. So the domestic market, and this would also apply in Turkey, doesn't fix the problem. It makes it slightly less awful than it would be, but it's still not a great picture for anybody working in travel and tourism. And of course, the airlines are having a terrible time because people are staying in their own country. By definition, they are not flying.
Right. And quickly, Ben, let me return to you because you tell us why many are arguing that the restrictions are actually less about safety and more about, politics. They're citing hypocrisy, particularly in the UK, where when it comes to determining who's on that red list and who's on the amber list. In my intro there, I cited the case of India being allowed to travel to the UK while Turkey is not.
Oh, absolutely. Yeah, that's a very pressing point, actually. So in the most recent review, there are a lot of people here in the UK saying, look, Turkey now, it's the perfect time for it to go onto the amber list. And actually, if you look at the data, that's very true. In a GISAID, which specializes in genomic sequencing, actually showed that Turkey had submitted the third highest genome shared in the last 90 days. And that's actually higher than some amber nations, or currently on the UK's amber list, that is. So that includes France, Spain, Greece, and actually the United States. So there is a lot of questioning around that decision, and many will question how long it's going to take until Turkey does indeed come off the red list. Last year, actually, travel was far easier from Turkey to the UK and vice versa. So with vaccinations in place, appropriate testing in place, I don't see why it can't be easier this year.
Okay. Oksana, let me turn to you because regardless, the WHO says there is a correlation between the spike in travel and the spike in cases. So even though Simon was citing, Australia's remained completely off the tourist map and totally isolated, and still cases are spiking there. Do you worry in kind of the medical field that there really is a correlation between increasing travel and for as much as the problem is still there, these travel restrictions do actually help?
Well, we know that the virus moves where people move. So, absolutely, with increased movement and with schools returning back to session, we are potentially going to see a significant rise. And that's particularly because the UK, despite having a very good early success with vaccine rollout, really a lot of that impact of that benefit has been stalled with their decision to not vaccinate teens. That makes the UK the anomaly when we compare to the US, Canada, Germany, Japan, Israel, many other countries. So we could see that depending on what the JCVI recommends in coming weeks, it is almost a bit too late now in terms of the percentage of the population that are younger and remain unvaccinated. I think, yes, we are in a totally different position than we were last year, even with Delta. And that's because we know that the vaccine is still effective in preventing severe disease and hospitalizations. And that has to really be the goal. So we still have a successful vaccine. But what we really need to be doing is to ensure that this vaccine is accessible in all countries, so that our air bridges are not just amongst the G7, and to expand that to countries that have very low rates of vaccination. But bringing it back to the Australia example, this has often been pitted as a zero-sum game of health against the economy. Yes, we do see that Australia has had to go back into short, sharp lockdowns, but overall has had less economic damage, much less mortality rate. So a lot of more lives have been lost here in the UK because of those early decisions. But I do agree that now we are in a position to ensure that there are, with vaccination, with the appropriate testing, that there should be some allowance for travel, but we have to keep encouraging vaccination rates. And for those that are unvaccinated, we do need to be thinking about other measures as well to protect the rest of the population.
Right. There's another conundrum I'm going to raise with you, Oksana, while I have you. You know, that you're talking about getting teens as well vaccinated. We're now hearing the case for getting booster shots to those who may be more vulnerable. But then there's the argument to say, forget booster shots, forget the teens that have zero death rate, basically, when it comes to COVID. And let's get the rest of the world vaccinated, and especially in poorer countries that may not be anywhere near the tourist and travel map, and be at all essential for, in arguing, the global economy. So how do you find the balance? How do you find the balance between, you know, getting the economy back on track and saving the fallout damage from economic struggle with trying to save as many lives as possible via vaccination in poorer countries?
Absolutely. There are a couple of points here. When we come back to the issue of children, we did see an increase, particularly in the United States, of rates of ICU admission amongst children. So that's something to really take seriously, as well as the fact that we're still learning about what those effects of long COVID could be. So we do have that Pfizer authorization. Even the WHO now is changing its tune and saying that children also need to be protected. However, the science around booster shots, I think, is just not strong enough to redirect supplies that could be going to low-income countries to give just-in-case shots to those who are elderly. And there are other things that can be done, layered protection for those individuals who are at greater risk. So I do think that until we address the underlying problem, which is supply, you know, this shortage, it's an artificial shortage. It is because only a handful of companies hold the patent to make the vaccines. Until all vaccine manufacturers have the permission to go ahead and make more, that shortage could be in some ways reduced, and we could boost that supply instead of giving boosters to people that already have a good level of protection. And when we look at the study coming out of Israel, we shouldn't be just making a policy decision out of that one study. Otherwise, we see, again, the core result on protecting against hospitalization, severe disease remains. So I think that we will see that difference. All the other industries really should be pressuring pharma to let temporary IP waiver, because it'll be good for their business too.
Okay. Ben, let me come back to you because I want to look again at the cases of Australia and New Zealand and at what cost they have chosen the isolation approach. Oksana was saying really their economy hasn't suffered that badly, but others argue their citizens have suffered quite significantly because they've been completely cut off from the world, even though and now they even have infections rising as well, but they've been cut off. And then there's the psychological cost of keeping people from their families, unable to even visit sick and dying family members.
Absolutely, yes. It's a very expensive cost in every shape and form. Domestically, in the short term, it might have been a good choice, perhaps in the early days of the pandemic. But with more transmissible variants, again, we have to opt for a risk-based approach, I think. And that's what we've seen in Europe. Granted, there have been repercussions of that. There have to be, sadly, sacrifices in that case. But we've seen travel open up far more in Europe with the digital COVID scheme, with the passport, sorry. And that has meant that amongst European countries, travel is far more free with a recovery certificate of full vaccination, or a negative test result. And I think I'm seeing words from Scott Morrison as well in the media that they're thinking they may need to opt for a different approach here, because at the end of the day, it's how long they can sustain this for.
Right. So, I mean, Simon, talking about that risk-based approach, tell me how far you think we are from saying, you know what, okay, forget travel restrictions. We now need to learn to live with this virus. We need to take whatever precautions we can. But those who are unvaccinated are voluntarily now putting themselves at risk, and they will have to deal with the consequences. And maybe if they want to travel and they do get the PCR test, if that remains one of the measures, perhaps there can be, you know, some rather expensive specialized COVID insurance as well.
Sure, that's all part of the solution, and it will undoubtedly be the case that you will have a kind of two-speed world. Those of us who are lucky enough to have their vaccination certificates, whether on a piece of paper or on an app, and those of us who don't, which may well be, of course, for medical reasons, and there needs to be a solution to allow such people to travel. But unfortunately, we're seeing things going into reverse. There's every indication that in the next 24 hours, the European Union could be reimposing a ban on even vaccinated American visitors, which would be very, very regressive. I think the solution long term, and we could be talking many months, we could be talking several years, will be that, yes, if you've been vaccinated, you will be regarded as much lower risk. There may be a small testing regime, but nothing like the rules we have at the moment. I mean, I travelled just a few days ago from Germany, a low-risk country, according to the UK, into the UK. I'm fully vaccinated, but I still needed to take a test before I set off from Germany and a test when I arrived. It's costing a lot of money. There's an awful lot of inconvenience, and that is most definitely keeping people from travelling. But here in Northern Europe, the summer is almost over. We're almost into September. Many people haven't really had a summer, and that is, of course, causing huge damage, partly emotionally. You were talking about people being separated from themselves and indeed from their animals, I dare say. But that is all part of this picture of keeping people away, apart, which medically, of course, many people are in favour of doing. But emotionally, it does have a cost.
Yeah. Oksana, I'd like to address the same with you. And I mean, if you can give us, I know it's hard to say. I know you don't have the crystal ball, so to speak. But I mean, how far off do you think we are before we get to the point where it's just decided we are living with this? Everyone needs to be responsible for themselves, take the precautions, get the vaccine, and we're going to open borders.
Well, I do think that living with COVID means that we have, for instance, more normalized measures in place. So whether that is, for instance, again, I'm bringing back into the context of schools because that's happening just around the corner. Living with clean air, having HEPA filters in the United States, offices, schools, these have all been installed so that kids have a safe place to learn and that we can get on with living. But that doesn't mean we do nothing. And I do think that we have to, in the United States, they seem to have a bigger problem with the anti-vaxxer movement. Yes, there are skeptics and hesitancy in the UK as well, but in the southern states, we see that some regions have less than 50% uptake. And that is definitely problematic because we know that in those areas with low vaccine coverage, with high levels of community transmission, Florida being one of those states that's seeing record levels of hospitalizations right now, more than at any other time in the pandemic, despite the accessibility of the vaccines, means that it also could bring in another variant. And I think that's what all scientists are really concerned about when it comes to this uneven coverage of vaccination, whether that's because of lack of access or due to these hesitancy and anti-vaxxer beliefs. So it poses a real problem to say how it will unfold from here on in. Ideally, if everyone was responsible and took the vaccine, if they can, some people have medical reasons that they cannot, but then again, use other methods to protect themselves and treatments as well. So very promising monoclonal antibody treatments that could be available for immunocompromised and other individuals. But until we get that last push on the vaccine wall front, really strengthening that, I think we're going to still have to check vaccine status and have that testing regime in place.
Right. It seems, Oksana, just such simple measures. The vaccines in the countries that are there, the fact that there is this hesitancy and this absolute denial to take the vaccines so that the program isn't working as fully effectively as it could. Also, the HEPA filters you mentioned. I mean, nobody seems to be more exposed to anyone else than when sitting together on a plane. Yet we've seen with those filtration systems on board, very few cases of COVID-19 have developed, even though people are in the closest proximity possible. But I want to get back to what was talked about when you mentioned the schools reopening, and that is a necessity. The WHO really did stress that on Monday in their press conference. They're saying schools just have to open. These closures actually stall academic performance and challenge children's mental health. So what are we up against if we can't move toward even the global reopening of schools?
Well, again, the priority for education has to take precedence. And in the UK, yes, we had the difficulties of homeschooling. We saw even inequity in terms of the level of education and support that children were getting. But in other countries, when children don't go to school, particularly girls, it means that they may not get an education at all. So it's really important that we look at all of the measures that are possible to ensure that teachers are vaccinated and to allow younger school-age children to have access to the vaccine as well. I think those are two of the things that could make the biggest difference because those are going to become the hot spots post-summer travel in the UK.
Right. And Simon, as far as really reopening travel and tourism, some of the measures that could be taken, you tell me what you think of this. I mean, I know as a person living in a country that sees a lot of foreign tourists, I just personally feel better knowing that in order to come into this country as a tourist, you would have had to had a negative PCR test within 72 hours before arriving here. Yet it's a huge hurdle there because PCR tests can cost, I think the average British PCR test costs over $200. That's more than the plane ticket for most British tourists. Yes. Go ahead.
Sure, yeah. I mean, of course, people want reassurance. They want to know that the people that they are traveling with do not present a threat to them. And having everyone vaccinated or at least tested is a very good way of doing that. And of course, it's expensive, it's onerous, it's time consuming. And for a lot of people, they're simply going to say it's not worth it. I think ultimately, humans love person-to-person contact. There's many people who will kind of go do anything in order to get back to the ones they love. But even so, while this goes on, we get mad situations, as happened overnight. Because at 4 a.m. on Monday morning, the UK said Montenegro in the Balkans is now on our red list. An airline from the UK had a flight specially to bring people out from there to the UK. That went technical, it couldn't fly. They then dispatched another aircraft to cross the border in Dubrovnik in Croatia. And lots of passengers from Montenegro, also some Albanians, some people from Turkey, said, but we're not allowed to go into Croatia, we can only go to the UK. And they were left behind. And they will now need to go into 11 nights of hotel quarantine when they get back to the UK. These sorts of issues, these incidents will really destabilise consumer confidence. And a lot of people are saying we just cannot take the risk that something will go wrong and we will end up with enormous costs and having to sit in a hotel room at an airport for 10 days. We simply are not prepared to take that risk. And all this time, there's people across the travel industry losing their jobs. We're going into the winter season in the Northern Hemisphere, and that spells, I'm afraid, yet more gloom.
Right. Simon, I'm going to have to give you the final word. Unfortunately, we're completely out of time for this edition of the Newsmakers. I'd like to thank all three of my panelists really so much for being with us, and our viewers, of course, for tuning in as well. Remember, you can follow us on Twitter at @the_Newsmakers. Let us know what you think. We'd love to hear your comments. I'm Andrea Sankey. We'll see you next time.